I have some brown spots on my neck. I think they're skin tags, but not all of them are sticking out. Do you have any suggestions of what they can be and how I can treat them? So obviously without seeing someone, it's difficult to say, but a lot of people can actually form pigmented skin tags around the neck, particularly if you have a slightly darker skin type. You may have a tendency to make brown skin tags. So they will essentially stick out from the skin. Other people may have seborrhoeic keratoses, which are slightly different. They can of course be elevated, but they're not on a little stalk, where skin tags kind of have a bulbous bit and a little skinny stalk at the base. And certainly we can treat them with cryotherapy. Seborrhoeic keratosis can come in a flat version, which looks like little brown marks on the skin, or they can be more raised up. So a lot of people describe them as warts, but they're not warts, they're not contagious, but they certainly are risen up off the skin surface, and you can get lots of little ones down the side of the neck. Of course, they can get caught or irritated with necklaces and clothing, and you can also get other brown marks on the face onto the neck called solar lentigines or sun-induced freckles. So certainly we can treat them with cryotherapy, which is essentially a liquid that turns into a gas, and we essentially freeze them. So I will just show it to you now. Sounds like that. It is a little bit stingy when it's done. The sting lasts for a couple of minutes and then it fades, and then we normally get you to put something like Vaseline on going to bed to help them to fall off. Now the thing you need to note, if you're going to do them on the neck, coming up to summer is probably not the ideal time to treat, because they will leave a slightly browner mark. A skin cycle is up to 28 days, so it's not going to just heal overnight. They will go slightly darker in the first few days, and then over the coming weeks they will start to shed. So I've done a couple of them on my arm, because what you'll notice is when you start to use fake tan, it will highlight up into it, and you can see that they've just recently been frozen in the last week, so they look a little bit darker, and then they're going to shed off with regular use of Vaseline and moisturizer. So certainly down the side of the neck it is common to get both skin tags and some seborrhoeic keratosis, and they can be treated with cryotherapy. But for very large skin tags, if the base of them is too wide, we tend to do what's called snip excision, where we use a tiny bit of local anaesthetic and snip them away.